Welcome to the AWIP podcast. I'm your host, Ray Smith. Here we focus on investigations and all things animal welfare related. We're bringing you in-depth conversations each week with animal welfare professionals around the globe, so be sure to find us on LinkedIn, YouTube, and Spotify. I'm really happy about our guest today. I know I say that every week, but I'm really excited about our guest today. Dr. Adam Stern, he's a professor of forensic pathology at the University of Florida. He's probably one of the most intelligent people that I know. Stern, thanks for coming on to the podcast. How are you doing?
Thanks for having me. I'm doing great. Just starting off my Monday with the midday podcast. So happy to be here.
Is everything going okay down in Florida?
Oh yeah, we're doing good. We don't have any hurricane right now, so that's always a plus.
I'm glad that we scheduled this right in the perfect time so that wasn't happening. So, Dr. Stern, I understand that you have kind of a different story behind how you became a vet and how you got into veterinary pathology. For those who have never heard a podcast done by you before, can you kind of talk to us about what your experience is and how you got to be where you are?
Yeah, sure. So my journey into veterinary medicine is not the typical. We often say, I was born and I wanted to be a veterinarian. I loved animals all my life, and that's just the way I went. For me, that wasn't the case. I liked animals, but it wasn't my career goal. I wanted to do counterterrorism was really the direction I was going. And in college, changed my major from essentially counterterrorism studies to biology. And when I became a biology major, I was really unsure of where I wanted to go in the biology realm. And so just started looking at all the different options and found veterinary medicine. I was like, that sounds rather interesting. So I started to shadow some veterinarians and work at a stable and shoveling feces from lots and lots of horses, putting some labor into it all, and figured out I liked it a lot. And so went to veterinary school. And then even then, for me, I knew what a veterinarian was because I had a couple of pets and I had a rabbit. So we took it to the veterinarian to, basic workups and things like that, but didn't really know what else there was to offer. And so vet school really opened me up to the specialties, and decided even in vet school, I wanted to be in sort of the back of the house, not the front line, working in a general practitioner's office or doing internal medicine, and really decided that pathology was the direction I wanted to go. It took me a while to figure it out. Didn't figure it out till about third year of vet school, but got there, and that's how I got my direction towards pathology, just not the typical way.
Not shoveling horse poop anymore.
No, not anymore. Those were summer jobs and, breaks from studying for your, endocrinology exam in undergrad and things like that.
Well, we were really happy when you accepted coming onto this. You're so celebrated and you're so like high profile in the veterinary world and in the forensics world in particular. So I have quite a few questions for you, Dr. Stern. I'm wondering if you can talk about common injuries and conditions that indicate that an animal has been abused. And I think like one of the questions I get a lot when I'm teaching people as well is like being able to distinguish between injuries caused by accidental harm and deliberate abuse. That sometimes it can be difficult to kind of discern between the two. And we as investigators rely very much on what your analysis is. So can you kind of talk about the differences between the two? What are things that you're looking for?
Yeah, so I mean, obviously, we're going to be looking at the totality of everything. Some injuries, they could be accidental, or the same injury can be intentional. So it really just depends on what you're dealing with. So for example, I had a case once, and it was a classic hit by car injuries: broken pelvis, broken rear leg, some claws were scraped up, had some road rash. So you look at it and you're like, 100% that's a hit by a car. And so that's how I reported it out, to find out that, yes, it was hit by a car, but somebody actually hit that dog on purpose, like intentionally ran the dog over. And so, some of them look exactly the same, right? But then others, if we do our autopsy and we see a really distinct pattern, maybe it's a skull fracture, and I'll say it's more of a circular fracture that's depressed. When I see something like that, that maybe, it's 3 centimeters, 3.5 centimeters in diameter, then I'm thinking of, a sort of heavy, narrow object. When I see that, I think of maybe that's a hammer, or something flat-headed like that. So it's going to be sometimes pattern recognition. Sometimes, honestly, it is really the pathology tells you one thing, but it's not the whole story. And then the investigation ensues. And I always tell people, I'm like, I can tell you the injuries, but you have to do the investigation part as well. Because as a pathologist, we can't answer it all. So we have things like that. Sometimes we're looking at, multiple injuries to multiple parts of the body. Maybe they're at different stages of healing. Some just happened, and then others happen weeks or months prior. So you get those old rib fractures, or you get that long bone fracture that's now just a thick callus that's healed over. But then you also have acute rib fractures. And so again, it's patterns. Not every injury is going to look the same, but if we look at the patterns, we look at the investigation, age of the injuries, multiple different injuries at different times. Those are going to be some of the things that we're going to start to look for.
Do you ever do any analysis on different types of weapons that could possibly have been used to cause these injuries? Like if an officer's, sending you, a necropsy for evaluation, can they send you suspected weapons too?
Yeah, so we had a case recently, and it's been adjudicated and all done, where we were given, it was a cat, and the cat did not survive. And so we were given, I believe it was 3 different potential weapons that could have been used to cause the injuries. One was a knife, one was like those guillotine nail clippers, like kind of the heavier metal ones. And I think there was a pocket knife involved as well. And so the question was which one caused the injuries. And the cat had evidence of blunt force trauma, but then it also looked like someone tried to cut off the tip of the tail, the ear, and some of the digits. And so, we looked at the injuries, and we knew it was definitely a sharp force kind of injury from that. And we took a closer look at all 3 of the potential weapons. And we actually, in those cases, we did DNA analysis. So we used magnifying glasses to look to see if we could find any old stains that dried up, so some dried up blood, and found only on the guillotine toenail clippers was there any evidence there was some dried blood and even a piece of fur. So we swabbed that material, and it came back with DNA from our cat. We did swab the other 2 weapons just for completeness, and we didn't get any cat DNA from it. So we were able to definitively say, yes, that's the weapon. So we do things like that. We've gotten a wide variety, oftentimes a lot of sharp objects. We've gotten samurai swords and all sorts of things. So, yeah, you never know what you're going to get until you get that history.
As much as I like these CSI shows, people think that you're just going to find the result in an hour. You just take it, throw it in mass spec, and boom, it's done. And I wish
Yes.
that would be the case. That would make things so easy, but it doesn't, right? Why does the process take so long?
So, yeah, it's that whole CSI effect, and I would love to be able to just take a little blood or a little bit of urine and put it in a test tube, put it in the machine, and voila, there's your answer. You're like, of course that's what it is. But it's not that way. I mean, and a lot of these for like these poisoning cases, one of the biggest things is there's a lot of different methodologies, and I'm not a toxicologist, but there's all sorts of GCMS, LCMS. There's a wide variety. You can do immunoassays of different tests, and there's different libraries that they use to look for these compounds. And some tests are fairly unique. So like cyanide testing, for example, there's very few labs test for cyanide. Your routine sort of, I say, drug screens are not going to detect cyanide. And so you really have to think about it, is that your toxin of choice, and specifically request that. So there's just a number of techniques, right? That's the first thing. The second thing is there's a lot of processing of those samples. So in veterinary medicine, a lot of times we we'll use tissues. So like an organ, for example, like liver or kidney, there's actually a lot of work that a toxicologist or a chemistry analyst needs to do just to get that into a state where they can process it. And so there's extra time there as well. Then the other thing is a lot of toxins, you do the autopsy, so it's going to take you a couple of hours. But a lot of toxins actually don't leave specific pathology. A lot of it's non-specific findings. There are some that you see this, if you see massive hemorrhages everywhere, okay, you can consider like anticoagulant rodenticides, for example, or some sort of medication. But a lot of the others, the clinical signs are so rapid, it's vomiting, maybe respiratory distress and death. And at autopsy, you don't see anything else. So we have to start going down the history, when was the animal healthy, clinical signs, and how long did it take for this whole event to transpire, and then start to, kind of do our best guess and start to, okay, let's start with like convulsions, the seizures and muscle fasciculations, and kind of go on from there. So it takes a little while. I did a case recently, and it probably took us, 3 months to do the autopsy and then start doing the testing. And when one test came back negative, then we do the next, and then we would do the next, and finally found what we were looking for. But it's sometimes finding the needle in the haystack.
Yeah, it seems like that would be super difficult. I don't envy your position because I wouldn't know the first thing to look for.
Well, and it's not just the time too. Some of it comes into finances. I know everybody is strapped for finances, and so we could say, let's just run 10 tests all at once. That might cost you $5,000. I take the logical approach. Let's do one test. Let's see what comes back with that. Especially if money is an issue, if time is more important, then we're just going to run those 5 tests or those 6 tests because time is your difference here. But if you don't have the worry of time, which many of these cases don't, because oftentimes it's a one-off animal. Now, if you have an animal, you have 12 animals that are in a community and they're all dying, well, time is probably a little more important because it could be someone is out there actually doing something, and we need to try to figure that out faster.
And what about the rate of decomposition? I would assume that it would be more difficult. I don't know if you want to call it like half-life, or if I'm just trying to spew things out to sound intelligent here, but it must be more difficult to detect if in varying states of decomposition.
Oh yeah, decomposition can affect it, but also what the chemical is itself. So some of them will have a really short half-life, so it's going to degrade pretty quickly. Others, it might be weeks before it actually breaks down. So you kind of have the time. So, those are factors to think about as well. And then also what sample you're testing. So if it's one of these sort of per-acute intoxications where it's ingestion and death within minutes, you got to be working with, say, stomach contents versus something that might take days would be urine. So you have to think about the process and where you would be in the metabolism phase.
Now, when it comes to embedded collar cases, is there any type of diagnostic tools that you use for determining like the degree or like the time frame of like how long that collar has been embedded, so that kind of helps the investigator when they're trying to figure out length of time that this collar has been on to maybe put in more of an accurate date and time of violation?
Yeah, so there is a paper that talks about the rate of growth of some of that scar tissue, and I always have to look it up because I always forget the exact time frame that's put in there. But there's that paper that kind of gives you a generalization of how long it takes for the granulation tissue to grow. One case I had recently being about a year ago, we actually had some maggots in the embedded collar area. And so we were able to use them to talk about their minimum time of colonization, so how long they were around. Some of these can be there for, weeks, months. If they start out as a puppy and then they grow to an adult, you have months of time. So there comes a point where you're just at, that was a really long time. And, I'd rather just say it's weeks to months. instead of getting bogged down into, well, you said it was 3 to 4 months and you were off.
Yeah, sure.
And every individual is different too, because if you're on a good nutritional plane, you might have granulation tissue grow at a certain rate. But if it's a poor plane where you just don't have the nutrients, it might be different as well. So a lot of variables, I think, that are in there as well. But I think that's still an area that needs a bit more work, for sure, is that rate of growth.
Now, some of the most difficult cases for me have been drowning cases and proving probable cause for that. Is there any good evidence you that you have examining the animal as a pathologist to be able to prove death by drowning?
That's a hard one. You're asking me good questions here, and drowning is one of the most difficult ones to diagnose. Really, a lot of the asphyxia ones are. So whether it's drowning or smothering, they're pretty difficult. So there's not one thing. So sometimes we see there's a lot of water, say in the stomach of the animal. We can see a lot of stable froth in their trachea coming out of their nostrils. That'd be another thing. You can see evidence of inhalation of foreign debris all the way down into their lungs, but you're not going to see that in every case. And so none of them would be the sort of pathognomonic, like it is this because we see this. But it's oftentimes the witnesses in those cases are important. Same thing with humans. Seeing the drowning event happen is going to be really important evidence. So when I have cases, a dog found dead in a pool or something like that, one of the things I ask myself is sort of like if they're an animal who's in a fire, right? You're proving life in the fire. You're also going to, sort of look for other reasons why the animal might have found itself in that situation. So if the animal fell in the water, was there a disease process maybe that could have explained why the animal had weakness? Maybe it had a brain tumor. Maybe it had evidence of an organ rupture and it was losing blood internally and then was by the pool, fell in. So we're looking for things like that. Just like in fires, if we figure out that, well, they weren't alive in the fire, well, then we have to ask the question, why dead? And so it's kind of, you back your way into these diagnoses sometimes, but then the eyewitness testimony, the digital evidence is going to be pretty useful in those cases.
For sure, yeah. Are there any patterns that we see for chronic neglect, like in cases of long-term breeding?
Yeah, so it's basically going to be a wide variety. It's just, poor care. So, we'll have animals that all their teeth are rotten, falling out. They're just not groomed, parasite laden, whether it's fleas or intestinal parasites, claws that are just not trimmed. So just the unkept, dirty appearance for a lot of these animals. And then depending on what kind of flooring they're on, they might have pressure sores or some urine scald, just a wide variety. And, we don't see just one. There's not one thing, again, that we see. It's just a totality of a mixture.
What are some of the bigger challenges in proving cruelty that you have to go through?
So I guess one of my biggest challenges is improving the way people deal with the deceased animals. So a lot of times I'll hear what people tell me is like, oh, I was told it was dead for too long and you can't do anything about it. Or, yeah, we found it, but we didn't think it was that important. We had live animals to deal with, or, all those sorts of things. And I think the big thing for me is to educate people, whether it is an animal control officer or humane investigator or law enforcement officer, that there's actually some really valuable information that you can get out of that. So, for example, here in Florida, we have a statute that basically it's an improper disposal. If it's dead for a period of time and you don't, bury it in the ground or, do certain things to it, it's a misdemeanor violation. But, maybe if you have 10, 12, 15 dead animals, and they're all in different stages of decomp, maybe you'll be able to find some causes of death there rather than just saying, yeah, we just have all these deceased critters and we're not going to do anything about it. So I think having more people look into that, it'd be really helpful for your case. It could, prove a lot of other things. Sometimes they are honestly too far gone because you need the soft tissue and all we have left are bones. And so, yes, there's going to be cases where you're not going to be able to figure out exactly what happened. But even then, there's times where I've looked at things and you're like, there's no way you're going to figure it out. And then you figure it out. Just happened to be that the thing that you needed was still there. So I always tell people basically, ask the question. The worst thing that happens is we look at it and we're like, sorry, we still can't figure it out, right? We're still undetermined. But if you never look, it's always going to be undetermined. But then if you look, maybe you get your answer, or maybe you get answers to some of your questions. Maybe not all of them,
Yeah.
but some of them. So I think that's still a big challenge, is to get people to do that, and then to work with some agencies and get them to improve their budgets, to put more resources towards these investigations. Because a lot of times I hear also, again, we're strapped for finances, but we're doing all these other things. But when it comes to the dead animal, unfortunately, we don't have money for it. So I think some of it's not the investigator's fault. A lot of times it's more the management, right? But kind of teaching management to be like, there's a lot of information we can gather here. So I think that's some of the stuff that I try to reinforce and educate and help with getting to that point.
That probably involves just giving resources to people who aren't aware of different types of grants out there that these national organizations and such can give to shelters specifically for investigations, or if they need equipment for conducting whatever their investigations are, or if they need help with grant funding for actually sending these deceased animals for necropsy. Those options are out there. I know that the ASPCA actually does give these types of grants out. I had applied for a grant from them a couple of years ago, and they helped out with a lot of stuff. They gave us like money for a freezer, for portable coolers to ship. So there are resources out there, and I think that education and just providing those resources to, especially like with more rural, they're arguably even worse off. Their funding is just practically non-existent, or it gets you know sent to the live animals that are being taken care of, and not so much like the deceased ones. And when they're working on these cases, that they could end up having a lot of success from.
Yeah, there's a lot of success you can have in these cases. We help out. We have a lot of different animal advocacy programs that we do, so we help with that as well. I think HSUS has some options. There's a bunch of organizations that do, and so I always try to tell people too is, plan ahead. Be aware of what resources you can have access to within your group itself, and then also have a plan. If you need to phone a friend, you need to call for help, plan it yesterday. So when you need it right now, you kind of have it set up already, because the last thing you want is to be surrounded by, 10 cats or 10 dead dogs or 100 live dogs, and you have absolutely no idea of where to start. And you just stumble upon it sometimes, and, or you come across 15 horses. Who's your large animal vet?
Yeah.
I don't know. So, and time's of the essence for some of these cases sometimes, because the animals, they do change, right? Which is a luxury sometimes. You have walking skeleton dogs and you feed them, they put on weight. And so you need to get it done sooner rather than later.
Do you think that understanding the pathology of animals helps improve animal welfare practices overall?
Yeah, I think so. The pathology is just another way to document stuff. There's a lot of benefits to documenting live animals, but then sometimes there's things you can't do. So not that I wish the death of any animal, but some of the strongest cases you might have a combination of the two, whether it's just a basic welfare issue or more egregious types of crimes. If you can look at the case from both aspects. There's just some things that a pathologist can just say, for sure, these things are not here. And this is why the animals look like that. And then the clinicians are like, yep, we didn't find anything either. We fed them and they got better. And so you really get that nice case. So there is definitely a benefit to pathology when I look at it from the autopsy perspective. But then there's also the same pathology in the live animal too. A gunshot wound is a gunshot wound. That's pathology. A stab wound is a stab wound, and it's differentiated from a laceration from being hit by something because of the pathology that you see. So pathology is a lot of people equate it to deceased animals, but at the same time, it's 100% in live animals too.
When you're looking at this animal and you're uncovering all of these horrific things that happened to them, and you're able to, for the most part, figure out what happened to them, what their manner of death was. How, and you're an animal lover, I think we can assume that, right?
Yeah, I got cats. I got 2 cats.
How do you maintain being objective when you're working with investigators?
So the first thing that I say is, what's my role? My ultimate role at the end of the day is not to the investigator. It's not to the prosecutor. It's not to the defense attorney, right? It's to the court. So my job at the end of the day is to inform the judge or the jury what I see and using science to do so. So that's really the first way I look at it. Whenever I teach anybody, I'm like, as cold as this might sound, is it doesn't matter what the investigator wants me to tell them. I'm going to tell them the same thing I'm going to tell a defense attorney. This is what I see, right? The animal's been shot. Yes, it is a front to back, left to right injury. The animal, it went through the heart and lungs. The animal bled out and died instantaneously to nearly instantaneously. That's going to be my answer, regardless of who would present the case to me. That's one way I maintain that objectivity, by just saying, yes, everybody wants justice for animals, but in this position, my duty is to the court, right?
Mm-hmm.
And
Yeah.
so it's really important for me to maintain that all the time. I don't want to have a case where, well, if it was a defense attorney, I'd look at it this way, and a prosecutor, I'd look at it that way. I never, ever want to do that. I strive to keep that objectivity. At the same time, too, my role as a pathologist is to document the case. I'm not here to investigate who did it. If it was the boyfriend, the girlfriend, the neighbor, the stranger, that's also not my role. That's the role of the investigator to do that. So I think really having these objective end results is important for me. And that's kind of how I keep it.
I think from an investigator perspective, it's very similar on point. It's like, of course, we want justice for the animal, but it almost sounds bad, but it doesn't really matter what the person who's reporting it wants or the community wants. It's like, this is your job, this is your role. I can just hand this stuff over to you, and then it's your turn.
Right. Yeah. So, I mean, I do a lot of community cat deaths, and I'll get all the time, it's somebody's poisoning the cat. I'm like, okay, fine. That's the history. Basically, the history really, we found the cat dead.
Mm-hmm.
It's, you don't know what happened to it whatsoever, and then
Maybe
you
those
find
same
out.
people that are calling you are calling me and telling me the same thing.
Yeah, and I think it's, I don't know why we always go for it's somebody doing something. And I think it's just the unknown. It's just, I don't know. I'm hoping it's not someone, but we don't know until we look. Sometimes, yes, it is someone, and then other times, like, well, no, the someone was a coyote. And the coyote got the cat who was out and about. We'll get cases sometimes where they're like, well, I live in a gated community. Well, the coyote doesn't care about the gate. It's going to get around the gate, through the gate, under the gate, and you look at it and you're like, nope, that is a coyote attack. And we'll do DNA analysis on it and prove it 3 or 4 different ways. And then sometimes people are like, okay, thanks. Or other times they're like, no, I still think it's the creepy person. Like, you can't win.
That's interesting. Can you tell so then like through DNA you can tell the difference between, a dog and a coyote, or, a
Yeah.
dog,
Yep.
fox, dog and a wolf?
Dog, fox, coyote, wolf. We're taking swabs from around the injuries. We don't go in the injuries because the injuries themselves, like the puncture wounds, will be just full of the animal's blood, and it's going to overtake any of the trace DNA that's left from the predator, right? And so when you think about it, if an animal bites my arm, it's going to bite it, grab it. One thing it's going to do, it's going to be salivating. And so epithelial cells from the mouth, they'll get trapped on like the fur. And so we go for that clump fur around the injuries and not truly in the injury.
That's why I learned something new today.
There you go. Now you can go home.
Yeah, see? Dr. Stern, I know that presenting evidence to a jury can be very difficult. I have read many, many pathology reports, many necropsy reports, and the language in there can be very technical, very difficult for, the average person, who is really what they're aiming for on a jury in most cases, to understand and comprehend. So what is the process of preparing a pathology report? And then what are some of the challenges when you're presenting the scientific evidence to a jury?
So there's a lot of things that go into it. So typically I write my draft reports and I read them again. And your pathology reports themselves, the actual meat and potatoes of it, is all non-technical. So it's your description. It's what you saw, what you smelled, what you felt, and hopefully not what you tasted, right?
I really hope not.
And so a lot of it's really, it's the colors of things, it's the shape, it's how does it feel. So really in that part of it, which can be, several pages, there's nothing really medical in there. The medical stuff comes later on, where we start making our diagnoses, and that's where where I say, like, where vet school and all the medical stuff I've learned come into play, because that's when you make your diagnosis. And so that's going to be the technical part. And then we'll look at tissues under the microscope. Maybe we're doing toxicology. And so all that'll get thrown into the report. And then in the end, we have our comment section, which is where, you surmise, this is what I think happened, right? So for most people, I think they might not understand what you saw because there's anatomy terms in there. And so for me, one thing I like to do is I like to supplement it with diagrams. So like a body diagram. Mm-hmm. So if I'm talking about, some weird point on the hip or the shoulder or on the skull, I can just, draw on a diagram of a dog or a cat, a horse or a cow, and be like, that's where it is. So if it's a gunshot wound and I say all these things, I'm like, well, there's the circle and it's on the head, and that's where it is. So it kind of makes it so I don't get all the terms, I don't know those anatomy terms, but the picture helped a lot. And then when I testify, and again, it doesn't matter who I testify for, whether it's for one side or the other, again, I'm there to inform the jury or the judge. Again, it just depends what kind of trial it is. And I read my judge and I read the jury. And you can tell when they are not following you or they were following you, and all of a sudden you're like, I just lost 3 of them. And so when I'm testifying, I think about, why did I just lose them? And sometimes it's just the term, so what I thought might have been a straightforward term and they didn't understand it, I'll just automatically define it. And the word like comminuted fracture, right, means a fracture that does multiple small pieces of bone. And so maybe I said comminuted fracture, and all of a sudden it was like deer in headlights. I'm like, oh, that's when you have multiple broken small bone fragments, and then they're back in. And so
that would be
I think it's
I'd be like, I don't know what you're talking about. I'm
yep.
looking at all the books behind you, and I'm like, there's probably like 80% of those words I don't understand.
Yeah, no, there's a lot of books back there. There's a ton. But no, I think it's important to understand your jury, because honestly, the jury in exit interviews, really the one profession they do like hearing from is the veterinarian. Mm-hmm. They have really high regards for the veterinarian when they do testify. And so it's important, if they want to hear from us, we have to get our point across to them. I did a case a couple of years ago. It was the Anthony Todd case, and it was a quadruple homicide, and then there was an animal death in the house as well. And the jury literally was on the edge of their seats as I was talking to them. And then all of a sudden, one person just sat back, and I was like, I just lost you.
Yeah.
But then, re-engaged real quick. So, you have to just know your jury. And I personally make eye contact. Some people say to look at the clock behind them,
Mm-hmm.
but I make contact with them because I want them to know I am speaking to them. I make it a point when I testify, I don't talk to the attorneys because they're not the ones who are making the decision here. It's the jury. And so I talk to them. And I think it just makes me a bit more personable than just some guy in a suit and tie.
And not like explaining things in a condescending manner. It was like,
Yeah.
It's inherent. Most people don't understand all of those technical physiological terms.
Start staring at the ceiling and doing anything else. And so again, like it comes back to your duty is to the court. And so I'm trying to do the best job I can so they can do their job.
Yeah. Well, Dr. Stern, before we wrap up, I want to make sure that we do talk about the International Society for Animal Forensic Sciences. And I wanted to discuss like the coffee talks and stuff.
Yeah.
So Jacob and I are actually members of the International Society. Thank you very much for approving that, by the way. We love it.
You're welcome.
I think it's really cool. You have people from what, like 80 different countries or something that were
so we have, I wish we had 80. I think we have 21 right now.
21, okay.
I think we have 21. 80 is a great number. Now that's my goal. Okay.
We'll get there.
We'll get there. Yeah, no, I love the coffee talks. They're so much fun because they're short and sweet, and quite honestly, I always learn something. And that's the goal of those coffee talks is, sometimes there's a topic and it's not relevant to your practice. I get that. Not every talk is going to be relevant to you or to me, but it's definitely relevant to someone. But for the most part, a lot of these talks, maybe it's in a species you don't deal with, but you're like, that's an interesting technique, or, that case study was really, interesting, but, I don't deal with rhinos, for example. If we had a really cool rhino, suspected drowning case, but you can replace that rhino with a dog or a cow and really have to do the same process. So my whole goal with them is really for you to walk away with something that you can apply that day. We're not doing these like, 8-hour courses or 5-day courses where it takes a long time. It's like, okay, pick the one thing that I want you to learn by the end of this, 25-minute talk.
Well, and I like that they're short too, because a lot of times there's so many trainings and webinars and stuff, and they're like an hour or two long, which is, in the grand scheme, not that long. But if you're an officer in the field, or, even if you're in the office, it's like, well, you have your regular duties. I don't have time to sit there for an hour or two and be actively engaged. Like, we need like a shorter period of time. I love that it's just like the half an hour.
Yeah, no, I think having them short is really key. In some ways, you get 20 minutes and then you're like, I gotta go do something else. So when we came up with that, I was thinking about the investigator, because they were on the forefront of my mind, and it was like, okay, they can't give an hour, they can't give an hour and a half. I'm like, okay, maybe they are in their truck, which is now their office, and they're drinking their morning coffee, and hence the coffee talk part, and they can drink their coffee and listen to it, and they don't need to necessarily see the screen sometimes. Just listening to what's going on sometimes is all they need.
And there's a conference that's upcoming, in May, correct?
Yes, yeah. We are renaming it Animal Forensicon, kind of going along the Comic Con and Crime Con and all of that.
That actually caught my attention. That's when I first saw it. I was like, oh, that's amazing.
Yeah, so it's called Animal Forensicon, the Animal Forensic Investigations Conference. And so, yeah, this in 2025, it'll be in Daytona Beach Shores. So on the Atlantic Ocean there. Be a really good time for sure.
I'm planning on going. The beach and forensics. I'm gonna totally nerd out. I think it's gonna be super cool.
Yeah, it's always good to nerd out with a nice drink in your hand.
All right, Adam, just my last question for you. Where do you think that the field of veterinary pathology will look like in, 10, 20, 30 years?
Oh, it's going to change a lot. It's going to change a lot.
Maybe we will have that mass spec that'll give us results in an hour.
That would be cool. I mean, they're doing really amazing things with these, like, and on the human side with infectious diseases and all that. So, I mean, who knows what we'll have in 30 years? But I think for me, I do have like my 20-year plan for sure. Like I really have 27 steps in front of me, kind of where I'm going. But I think the things that I know we will see is I know we will see a big growth in the access to veterinary forensic pathologists. So those board certified pathologists, and then they've done their extra training in forensic pathology. So relevant to the crowd that we're engaging right now, I think that's something that we're going to see more of. It's just going to take some time. Like, we have the foundations laid, we have training programs, but right now there's only two. We have one in the University of Florida, and there's another at Cornell, and that's it.
Mm-hmm.
So I think we're going to slowly populate the field, but once we start to get more and more people, then we can train more and more.
Mm-hmm.
And so, hopefully in 5-10 years, we'll have a really good crop that we'll start to see that sort of explosion of more. I mean, I know I talk to vet students, I talk to pathology residents, and there's an interest. It's just we need to get the access to it for
Mm-hmm.
them.
Yeah.
So that's the big thing for me right now is training and getting more veterinary forensic pathologists out there.
Is there anything else that I didn't talk about or I didn't mention that you want to make sure that whoever's watching this is aware of, whether it's, what you do or cases or what the International Society for Animal Forensic Sciences does?
Yeah, I think the thing I always try to say is ask a question, right? I'm always around for answering questions, but ask questions about your case. Like, for any time you're dealing with an animal case, whether it's the animal evidence or it's a potential weapon, you have to think about, if I get that analyzed, how is that going to help my case, right? What's the questions that I have? And maybe you're new in the field. Maybe you've been around for 25 years, right? There's always something new you can learn. We all don't know everything. I don't know everything. I have all these books behind me, so I mean, I have to look stuff up all the time because you all that knowledge, it just can't always be right at the grasp for you. So really ask questions, other experts, contact colleagues, because they might have had not that case, but maybe something similar where they had a similar question, and then they might know how you might want to go about answering it. Because sometimes it's just the technique is there, you just don't know what it is. And so, phoning a friend, phoning experts can really help your case out a lot.
Well, thanks, Dr. Stern, for coming on to the podcast. I really appreciate it. I know that Jacob does. He couldn't be here, but you're such a great expert. You think you're so good at conveying all of these ideas and explanations about pathology. So, Dr. Stern, thank you very much for coming on. We do appreciate it.
Anytime. Thanks for having me.
And thanks to all of our listeners for tuning into the AWIP podcast. If you're interested in joining the International Society, you can just do a Google search, go to their website, and join that. They've got a lot of information that is really, really beneficial for whichever field that you're working in. And just be aware that come November 4th and 5th, AWIP is putting on our first annual virtual conference. Details were just released on both mine and Jacob's LinkedIn site. So it is free. It is a free conference to attend. We're giving tickets away like Oprah Winfrey. Everybody gets a free ticket. So make sure you come because Dr. Stern is going to be speaking there. And so we're really excited. And thanks to everybody out there for tuning into the AWIP podcast.